Hi, everyone. I just wanted to talk about the news of the clearance of a digital app to try to reduce depression. This is important because there's no mention of genetics when they talked about the clearance of this device. And like anything that you're going to use for depression, you got to make sure that you're attending to your genetics. So real quick, let's take a look at this device announcement. The device is called Rejoyn. You'll see it in the news out there. Otsuka and Click Therapeutics announced the U.S. Food and Drug Administration clearance of Rejoyn, the first prescription digital therapeutic authorized for the adjunctive treatment of major depressive disorder symptoms, MDD. That's the announcement for Rejoyn. Just to be clear, FDA cleared it, and a clearance means that they said it looks safe so far, and now comes all of the studying to show if it actually helps. The Rejoyn company think it helps, and now they get to prove it, and they're allowed to even sell it and have people start using it in the community. Now back to genetics. So why am I talking about this? It's because if you have a variation in your MTHFR gene, right? This one, MTHFR, I talk about it all the time. If you got an issue with your MTHFR gene, you have to treat it. You can do 1,000 other things to try to help your depression, but if your DNA is kicking out bad mRNA that's going to create bad MTHFR, you're not going to be able to make enough serotonin for all of these other things to work. Where's my prop? Once again, your brain is like a sponge, and it needs to be nice and saturated with serotonin for all of these other treatments to squeeze that serotonin out and get a benefit from it. If you're not making the serotonin properly, then you're not going to get that benefit. But once again, what I like to tell people is we could remedy this for the next generations to come if we could just get MTHFR included in the PKU test. So real quick, what's the PKU test? PKU is a test that's done on all newborns in most developed countries around the world, even in a lot of third world countries. Because children who have that variation, they can become really sick and die. So that test is done, even though very few children actually have the problem. And this is a test that's done usually 3 days after birth. That was the next picture I was going to show there. They call it a heel stick. And this is where you've got a little drop of blood being taken out of the heel of this tiny little baby's foot, and they drop it on a card, and they then punch out these circles, and they can do a test in the lab to see if the child has PKU or a PKU problem. So, this is done to all children. We're taking a drop of blood. Nothing nefarious is being done with it. It's just a single test. It's not looking at an entire genome. Nothing's being kept. They just are checking it in the lab for PKU, and then that goes on the chart, and the parents know if their child has a PKU issue. What I'm always saying is please, 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 and I'm going to one day figure out who to talk to about this, we need to also include the MTHFR testing with that PKU. Because for so many people, an MTHFR variation leads to depression, anxiety, OCD, trauma, more mental illness or more severe mental illness down the road, and it kicks in early. You've heard me talk about genes that kick in later. MTHFR kicks in early, and it needs to be treated. And it is also a nutritional deficiency, which is what PKU is related to. And it's so easily treated with a custom vitamin and can change the trajectory of a person's life. I've seen it over and over and over again in hundreds of patients, and it's so important. So I just wanted to jump up on my soapbox and talk about that because of this Rejoyn app that's coming out, and how people will really need to have their MTHFR tested as well to make sure that they're not missing that piece when they're starting to use the app and hoping for a really nice, robust response.